In a nutshell, when one is diagnosed with cancer, it's a massive shock and you are then put onto a big roller coaster where lots of things happen to you and you have absolutely no control. We're very good at diagnosis and treatment, but what we're not good at is then supporting people into recovery and survivorship from cancer. And this is where it is absolutely crucial that the rehabilitation services are available and are part of a personal plan for people to help with their recovery from cancer.
That this work is really important, and we know it's really important because all of the work that we've done up to now tells us that cancer rehabilitation is really valued by patients and service users, and also that it's not often well understood. And what I mean by that is that the wider health and care system doesn't always understand the scope and the breadth of cancer rehabilitation, how important it is, and also the fact that it should be commissioned across the whole of the cancer pathway. So in other words, it's important early on in the cancer pathway and all the way through treatment and all the way through. So it's really important that we have good commissioning guidance so that commissioners have got a clear idea of what good looks like and then also how it should be commissioned. So we're doing a piece of work now and we've got some commissioning guidance that's due by the end of June this year. And the stakeholder engagement event that we've had today has been fantastic because it's been a great way of hearing from service users, from carers, from people in the system who are actually using our services and helping us understand what good looks like. Because what we want to develop as part of the guidance is a suite of resources. And one of the things that we're hoping to do is develop a benchmarking tool. And that's one of these resources that we hope that services will use and find helpful, and that can help them benchmark themselves against what we've said good looks like, and that's obviously been helped by service users themselves. So we're really excited about today and about the whole piece of work.
What we're trying to do is work out what a really good cancer rehabilitation service looks like. And today I'm really excited because we have got a whole room of patients who are telling us what matters to them about their rehab services and what's gone well, what hasn't gone so well, and what a 5-star service to them would look like. And I've been in cancer rehabilitation for many years, and yet these guys are the real experts, and they know what's important to them. And we're starting this project with the patient voice, so the patients are at the heart of what we're doing, and I'm really excited and already learning loads about what they're saying, and I'm hoping that as a result of today we can make cancer rehabilitation services in London better.
But I think in hindsight, knowing that the service is there and that it's easily accessible, and I think from having been close to quite a few family and friends that have also experienced it, they weren't really aware either that the service was there, so I think that's quite key to people like me.
And what mattered most about cancer rehab for me was the understanding that having had treatment, I was left with a lot of side effects, and actually to overcome those I would need intensive rehabilitation. It wasn't easy to access those services and it wasn't part of my treatment plan. I actually went out and found those services for myself and was also helped by the Dimbleby Centre. And it's absolutely crucial to have those services in place. What matters most is that people are actually able to access the services and know where to access the services and what is available to them. And that currently is not an experience that everyone has.
What matters most to me and to other laryngectomy people is to have our speech quality improved. Like I said, some people when they talk, we hardly understand them. It's either they are whispering or not. But we want to improve the quality of our speech so that well, as much as possible, those of us who are in one profession or the other can carry on with that profession as much as possible.
I do wish that that had actually all been discussed with me at the point of diagnosis. It may be something that actually is difficult to take in, but I think I would have felt much more supported to know that there was going to be aftercare once I'd been through my treatment.
So I'm a member of the Esophageal Cancer Patients Association, so you talk to people that have gone through a similar experience to you. But of course within that, each symptoms are different. Some people suffer from reflux, where you get this kind of acid coming up through it. It doesn't happen to me, but it happens to other people.
This speech therapy is the main focus after the surgery. It appears that most of us laryngectomy survivors, we are left to the care of the speech therapist. They are the people who do the management for years. This speech therapy is the main focus after the surgery. It appears that most of us laryngectomy survivors, we are left to the care of the speech therapist. They are the people who do the management for years.
But also the physical aspects, because I was very weak when I came out. I suffered from a lot of muscle atrophy and also bone density as well.
Something that was actually integrated into the chemo, something that could have taken place alongside my chemo, because that's when I had a lot of the physical side effects, would have been amazing. And then for that to follow on, maybe anywhere between 2 to 5 years, I think is realistic, because I don't think it really hits you until you've come out of the system, so to put it, until about a year after treatment's ended. So it's really important to have that going on long term.
For me, a 5-star rehab service would be a service that has a holistic approach. So it works as a joined up service with the initial treatment, so that everything actually works together, because post-treatment there is a lot of rehabilitation that needs to happen. So a good service would be one that actually builds that into the patient's treatment plan initially, so that it's not something that you actually have to go and find and access afterwards. It should be part of your treatment. The key is for all the services to be joined up. There needs to be communication between each of the different services to ensure that the patient recovery path happens smoothly and they get access to everything that they need.
A 5-star rehab service would be something where you have an individual integrated plan for you. So obviously having an integrated care plan for you based on your needs and assessment. And also I think is understanding what's behind that plan. In other words, understanding why you're eating the right type of food, and which is very kind of healthy. For example, for me, I was told to eat lots of fats because there's more calories in fats than there is in carbs and protein. But I didn't want to come back in 2 years' time with a heart condition, and therefore it has to be sort of tailored towards you.
We developed this tool to be used in a team environment, so we'd really like you to take some time away from the clinical environment as a team to sit down and actually reflect on the questions that are asked in the tool. We envision that the tool will take only about 20 to 30 minutes to fill in. We would really advise that you have a look at the tool before you fill it in and start having a think about what your answers to some of those questions may be. The tool has 6 values within it, so 6 sections. Each of the values are scored, and what we'll ask you to do at the end of each section is actually to score up each of your answers, and then again at the end of the tool have a complete overall score. What we'd then like you to do is to have a look at areas where you've performed well, and then also areas where you may want to think about where you may be able to implement some service improvement activities. We've also developed a service user feedback form. That form can be used in tandem with the benchmarking tool. You may want want to actually get service users to fill in the tool prior to you using the benchmarking tool, and then actually have that information there ready to utilise when you're filling in the tool as a team. So we envision that the tool will be used regularly, and we think probably about every 6 months is achievable. What we would say at the end of completing the tool is to actually have a think about what your action plan is for the next 3 to 6 months, and then check in again with the tool at the end of that time to see what improvements may have been made and where your scores may have come up in certain areas.